Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discussed increased tick illnesses, alarming spread of fungus, and super seaweed innovations. Let's wrap things up. This is episode 178 for the week of March 27th. I'm Matt Moneypenny.
And I'm Albert Bettistelli.
Before we get started, our diagnosis code for this week is Z62.1, parental overprotection.
That's a diagnosis
Everyone knows.
code. Helicopter
That's right.
penguins.
That's right. Everyone knows an overprotective parent. And many of you, if you aren't a parent yet, will likely be a parent at some point.
Wow.
Yeah.
I'm imagining
cool.
how one would get diagnosed with that, though.
Yeah, I don't know either. Maybe that seems like you need to really dive deep into the root cause.
Mm-hmm.
For sure.
Like you're getting ill because your parents never let you go outside and
Right.
your body's not used to any kind of bacteria or something. I don't know.
Yeah. And then they have to like probe they got to figure out, they got to probe questions to the parents. And that's a very involved diagnosis code for sure.
Yeah. But
there you have it. Anyways, we've got the first story of the day is CDC warning. Tick-borne illness cases in the United States are up 25% since 2011, according to a new report from the CDC. The CDC says that cases of babesiosis, which can cause an illness ranging from asymptomatic to severe, can have increased significantly. Symptoms which can last for several weeks typically show up between 1 and 4 weeks after a bite. The most common symptoms include fever, chills, sweating, fatigue, and myalgias. Did I say that?
myalgias?
Oh.
I don't really know.
Yeah, I think you're right. And myalgias. The disease is already considered endemic in Connecticut, Massachusetts, Minnesota, New Jersey, New York, Rhode Island, and Wisconsin.
Yikes.
The CDC always puts out very timely reports, I've noticed over the past couple of years of doing this podcast. Basically, when ticks start coming out, so too does, what is it, Albert?
Lyme disease?
Yes, sir. And other diseases like babesiosis.
Oh, yeah, that
I
one.
just talked about it. What the heck?
Babesiosis. Yeah, that's right.
Babesiosis. Whoa. Whoa-siosis. Whoa, buddy.
Whoa-siosis. I don't think I've ever had a tick bite, but I don't know for sure.
I've definitely had a tick bite. Ticks are scary, dude.
They are scary because you don't really see them, and then all of a sudden they're in your skin, and you're like, oh, there's one. You gotta like burn it out sometimes or rip it out, and then they give you diseases. Yeah, that's tricky. I love hiking and being outside, but ticks, yuck.
Yucky.
Be on alert, folks, for ticks.
Ticks are
really
scary.
Tick me off.
Yeah, I'm really ticked off right now.
Yep.
Nice.
All right, next up, more from the CDC. The CDC is calling an emerging fungus an urgent threat after a new study showed it had been spreading at an alarming rate throughout healthcare facilities. Cases of Candida auris, which is resistant to several antifungal medications, has increased each year since it was first reported in 2016. Its most rapid rise was in 2020 to 2021, according to the study published Monday in the Annals of Internal Medicine. The fungus can infect the bloodstream and even cause death by invading the blood, heart, and brain.
Man, there's been a lot of fungus. Sorry.
Right?
Go ahead.
More than 1 in 3 patients die from such an infection.
Man, there's been a lot of fungus.
There has. A lot of fungus.
Ever since The Last of Us released, there's been a direct correlation to more fungus-related stories, which could be just a tactic to get more clicks. But it's also scary because it's like, whoa, 1 in 3 patients die from this? That's insane.
Yeah, that's really, really
scary.
High.
Yeah, it's scary. Like, what the heck? What are you supposed to do? How do you fight this if it's resistance to antifungal medication? How do you fight this thing?
Right. And how do you know if you have it? Like, what are the symptoms?
It's terrible.
Mm-hmm.
All right. Well, watch out for Fungus. There's a
Yeah.
fungus among us.
A fungus among us.
Yeah. And if you get this one, you're not going to be a fungi.
No,
It's
you
not
might
a-
be. Yeah,
Yeah.
be a
So
dead
watch
guy.
out. Watch out. I don't really know how you get it.
Me neither.
But probably has to do with something related to moisture. If I had to guess. Because moisture grows fungus a lot of times.
Mm-hmm.
Next up, super seaweed, an innovative study conducted by Tel Aviv University and the IOLR, has succeeded in dramatically increasing the health and medicinal value of seaweed. It can now be used in the superfood, pharmaceutical, and cosmetic industries in the future. Yet, to make maximum use of it, the ability of seaweed to produce healthy natural materials in larger amounts is necessary. The current study focused on enhancing the production of bioactive compounds such as antioxidants, whose concentration has doubled, natural sunscreen concentrations tripled, and unique protective pigments of great medical value that were stimulated substantially by tenfold. The innovative and sustainable approach of the integrated aquaculture combines seaweed with fish cultivation, upgrading the seaweed, while at the same time helping to purify the seaweed and minimizing negative environmental impacts.
Ooh.
Whoa, a lot of buzzwords in
Whoa.
that story. Threw a lot at you there.
Mm-hmm.
Basically, seaweed is helpful, and seaweed is
Yes.
being added to more products because it is helpful. And if you add fish cultivation to the seaweed, it becomes super seaweed, which brings us all together to the entire title of this section.
Super seaweed.
Ba, 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 ba. You think that has
Yep.
a theme song?
I was imagining seaweed wearing one of those little masks like across its
Seaweed
eyes.
wearing seaweed as a cape.
Yes.
Whoa.
Whoa.
Scary. Anyways, let's go on to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest breaches all across the world. Albert, lead us off.
All right, Ferrari fudges the lines. Ferrari has disclosed a data breach following a ransom demand received after attackers gained access to some of the company's IT systems. While the company said that the attackers gained access to its network and the attackers demanded a ransom not to leak data stolen from its systems, Ferrari is yet to disclose if this was a ransomware attack or just an extortion attempt. Ferrari says customer information exposed in the incident includes names, addresses, email addresses, and telephone numbers. So far, Ferrari is yet to find evidence that payment details, bank account numbers, or other sensitive payment information was accessed or stolen.
Gotta say, if you're gonna do a ransomware attack, doing it on a high super luxury car brand is a smart thing, because your ransom could be just give me a Ferrari.
Right. Just give me one of your Ferrari.
One Ferrari, please. And I will give you and unlock your system.
Yeah, that's hilarious. Also, you know that the email addresses you're getting are from like some bougie people because they're buying Ferraris.
Right. I definitely think that attack, other beyond the fact of getting a Ferrari as payment, the auto industry is so massive and they've been around for so long that you would think that they'd have a really high cybersecurity infrastructure, because there's a lot of trade secrets going around about it. So that is crazy.
Crazy.
Next
But
up, third party. Oh, what?
I'll take a Ferrari though. If someone has an extra one.
Me too. And if anyone has a Ferrari, there is a Ferrari donating link in the description of this podcast.
Yes, please use it.
We are opening and accepting Ferraris for donation.
Thank you. Yes.
Even if we get one, we'll take two. It's okay.
Right.
Anyways, next we've got third party strikes again. The National Basketball Association, or NBA, is the latest organization to suffer a data breach with fan data stolen following the hack of a third party newsletter service provider. The association started informing affected fans last week, only describing the data theft as, quote, an incident they are sorry for. The data stolen from the unnamed third-party provider includes names and email addresses, but did not include usernames, passwords, or other personal information. The NBA said that it had activated its incident response procedures upon learning of the unauthorized access. Even though the NBA itself wasn't hacked, the association has hired outside cybersecurity experts and is working with the service provider to ensure that a breach does not occur again.
Huh.
There we go. That's why you gotta always make sure that working with third parties is just part of business, but you gotta make sure that you can trust them to handle some of this data.
Mhm.
Because I mean, at the end of the day, phishing attempts is probably going to be the only thing that happens with this. But I imagine that some of the people involved in this newsletter will fall for that phishing attempt just based on statistics out there for people falling on phishing attempts. So
Yeah, for sure.
hopefully things are better with the next third party they choose, because I imagine this third party is no longer going to be a client of the NBA.
Right. Interesting that they chose to attack a newsletter, though. Hack a newsletter. Like, it's just such a innocent little, first of all, the newsletters seem so quaint in general. Like, oh, so they still send out newsletters?
Right.
And then it's like, that's what we're going after. Whoever
That's what we're doing.
These 11-year-old kids that signed up for the NBA newsletter to follow their favorite star. Like, I don't know. It's just funny.
Right. Well, people will hack anything.
Yep, they sure will. All right, last up, Congress kerfuffles. At least 17 current or former members of Congress had personal information exposed in the hack of the District of Columbia health insurance data system, and that number is expected to rise. Hundreds of congressional staff may also have suffered a breach of their personally identifiable information. According to multiple reports, a breach might have impacted more than 56,000 people. In an alert to congressional staff, the Senate Sergeant-at-Arms warned that the breach exposed the names, social security numbers, birth dates, home addresses, email addresses, phone numbers, race, and ethnicity of at least some employees who work at the Capitol.
Jeez.
Yikes.
Now, people could argue, especially depending on your view of government, that this was worth it. But
yeah, sure.
Jokes aside, it's not good. 56,000 people is bad.
That's a lot of people.
That is
and
a lot of people.
Very important people that you now have social security numbers for and home email addresses or home addresses.
I feel like this is an attack on national security. I feel like that's probably how it's going to be viewed, or at least spoken about among Congress people.
Right.
So,
especially if they find out it was if they find out it was a foreign entity that did it.
Right. It's definitely going to be, I imagine it's going to be prosecuted as such, for sure.
Oh, for sure.
Because these are world leaders at the end of the day. No matter what your view is of Congress and people in Congress, there's probably some people who are senators or representatives who you don't like. But at the end of the day, they're elected officials to run this country. So, yeah.
Can't just go stealing their crap.
A lot of unique breaches this week.
Yeah, it was fun to read, though. I mean, not fun, but yeah.
Interesting to read them. Yes,
people getting creative.
And that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny,
and I'm Albert Battistelli,
and we'll see ya next week.
Bye.
Thank you for listening to the Bandage Podcast produced by eTactics.